I knew what the family was about to face was a pain and trauma that I would never be able to imagine, and that I just knew that I needed to keep it together and do what I would want done if I were in that situation.
I was extremely grateful that she thought enough to call me to go to help her and her loved one through this. Probably the hardest day of my professional nursing life, I would say, but I am so glad I got to be there to care for her daughter, and that Leslie and I were there with her the entire time as she took her last breath.
How we all came together and stood by each other, and we didn't let the other one falter. When one was starting to falter or starting to crumble, the other one stepped up.
And that was important to all of us. One, we didn't want Randa to be alone. We didn't want her family to be alone. And I think that for me is the most gratifying part, is we gave her a little bit of peace in a really horrible situation, to know that we were there with Randa.
I can't even describe it. It's just so wonderful knowing that you have a group like that in your corner. The way they ran to the hospital that day, I could never pay them back for that. I'm glad I didn't know what I was asking them to do that day. But there's no one else I'd want caring for my family more than them.
Every person in that room, not just the 5 of us in the coffee group, every person in that room knew Randa.
Randa was the oldest of 5. She had siblings. Her brother was 2 years younger than her, and then 3 little sisters. Randa was a typical first child. She was the mother hen of the group. Her little sister was her best friend. She was trying to decide what she wanted to do with her life, and all of her options involved working with little kids. I want to tell her story to say thank you to the Sanford family for all the support they gave us. It was truly amazing and overwhelming, just all the love. That's what's gotten us through this, is all the love and support we've gotten from everyone. I don't know how you would get through something like this without that support. From Bismarck to Fargo to Bemidji, up to Rainy Lake and down to Vermilion. I mean, it was the whole Sanford enterprise just gave us so much love and support. It's been amazing. The card was signed by pharmacists from all over the enterprise, and it's really nice to have something tangible here. Randa loved being she truly loved being a lifeguard, and so to have these benches be here at this place that she loves is just such a special gift that they gave us. So I think they started trying to raise enough money for 1, and then they ended up with 2. It really helps to have her remembered here, where she was so loved, and a place she loved so much. When we established the scholarship, we really wanted to honor the thing that was most important to Randa, and that was community service and working with children. And so as part of the scholarship, kids write a story about what it means to be a mentor. This year we were able to give 6 $1,000 scholarships to Chamberlain seniors. We gave more scholarships away this year because it was her classmates.
Many of the people who contributed to that scholarship fund and in that endowment that allow this to go on forever were Sanford colleagues that Jerri Ann and I and Kayla and Leslie and Sarah, we didn't even know them. They read the story and they were moved to give.
I want to tell Randa's story because I think it's such an amazing example of rural healthcare, what it means to be in rural healthcare, where you are caring for your friends and family, and you're there in their best moments and you're there in some of the darkest ones.
you're so glad that you got to be there and be part of it and care for people that you know and that you love.
I have the opportunity every day to interact with residents, with patients, and with the community, know them like friends, and they're more than colleagues and they're more than just people that we give care to.
In 1 minute, your life can change completely. You may be working back in OB and doing a delivery of a healthy newborn, and in 5 minutes, you're coding your best friend's daughter.
Number one, it makes you thankful. Thankful that when things like that happen, you can be there for each other, that you know who you're taking care of. Number two, I think it gave us all great comfort to know that Randa didn't die alone. She didn't die in a room full of strangers. She died with people that cared for her and knew her.
I'm pretty sure I helped deliver Randa. So I wasn't Jerri Ann's labor and delivery nurse, but I was Randa's baby nurse. We've watched her grow up.
You see a young person from birth to death, and I can't think of another space, another career, another calling, where you really are there for someone through their whole life.